tube defect. So what is neural tube defect? Neural tube which is closed during the intraocular life, but if the neural tube does not close, it leads to the neural tube defects. The failure of neural tube to close by 3 to 4 weeks intrauterine life. First point is failure of failure of failure of neural tube defect, neural tube to close at 3 to 4 weeks intrauterine life. IUL, intrauterine life. So what is the risk factors? Risk factors. What are the risk factors? The risk factors associated with neural tube defect are: first one is the diabetes. So diabetic mothers, and next is the obesity in mothers, which leads to neural tube defects in the fetus. And next one is the taking valproate or carb, carbamazepine during the pregnancy will lead to neural tube defect. During pregnancy will lead to neural tube defect. And next one is the previously affected pregnancy. Suppose first time getting pregnant, pregnant, and first time getting pregnant, having neural tube defect increases the chance during the second time, during the second time, increases the risk during second time. Hence neural tube defects are much higher in the second time pregnant. And how to diagnose? So we can do diagnosing antenatal antenatal diagnosing. Antenatal diagnosing is in the amniotic fluid. Amniotic fluid. So cholesterase is the most specific and best marker. Acetyl acetylcholinesterase cholinesterase. Acetylcholinesterase is the most specific and best marker. Most specific and best marker. And you have alpha fetoprotein. Alpha fetoprotein is most sensitive for detecting neural tube defect. Sensitive, most sensitive is alpha fetoprotein is the most sensitive marker for neural tube defect. So how to prevent? So now we discuss how to prevent the management, or how to prevent. So how to prevent is nothing but giving folic acid, giving folic acid, folic acid during during so we give folic acid during before before 1 month, before 1 month of conception to till 3 months after after give 3 months of pregnancy. So 3 months of pregnancy. So first month before conception to till 3 months of pregnancy is given. What is the dose given? What is the dose given? The dose given is 0.4 mg per day. 0.0 mg for per day is given for the primary prevention. If suppose they were, if the mother has been affected with neural tube defect first time, and the second time we will give increase the dose for secondary prevention. We will give a dose of 4 micrograms per day, 4 microgram milligram per day. So this is how we may how to prevent the folic acid. And next is the neural tube defect. A neural tube defect or classified neural tube defect is given by the short form of NTD. NTD is the neural form defect. And neural tube defect is classified into three types. First, first is craniospinal, cranio to spinal, and second one is the cranial, and third one is the spinal. In the craniospinal, they have craniorachiasis. Cranio, craniorachiasis. What is we will discuss later. What is craniorachiasis? We will do. In the cranial, it is divided of two types again. So it is closed and open. So it is closed and open. What is closed? Closed is called. 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 Closed is called Emphalocele. Emphalocele. Closed. Envelope. Enveloped cephalocele is closed. And opened is called absent. Absent. A for absent. Anencephaly. 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 And in the spinal cord, and spinal cord, it is classified into two types: closed and opened. And closed one is called as spina. Closed one is called as, I will write here. Closed one is called as spina bifida, bifida occulta, occulta. And opened is called spina bifida cystica apparata. Spina bifida, bifida cystica, cystica and apparata. So this is together. And what is craniorachiasis? What is craniorachiasis? So neural tube defect is of three types, divided into three types: craniospinal and cranial and spinal. Cranial spinal is nothing but craniorachiasis. The entire brain and spinal cord will be seen in the. This is the most severe form of neural tube defect, and entire from brain to spinal cord there will be a defect. It's called craniorachiasis, craniorachiasis, craniorachiasis. And next one is the cranial. Coming to the cranial, the closed one is called emphalocele. The emphalocele, the differentiation factors between emphalocele and anencephaly is open is anencephaly. So you can see the entire brain in the anencephaly. So you can see brain, open brain in the anencephaly. Whereas anencephaly, you can see the brain. Where emphalocele, you have a skin. You have the skin covering the brain. This is called emphalocele cranial portions. And next one is the spina bifida cystica. Spina bifida cystica is nothing but the spina bifida cystica, the this one, the open spina bifida cystica or apparatica is divided into two types. We divided into two types. First one is the meninges. Next one is the, you can see meninges, meningocele. First one is the meningocele. Next one is the mylingocele, mylingo, mylingo meningocele, meningocele, meningocele. myelin and myelin is called as meninges. You can see the meninges covering the spina bifida cystica apparatica, and meningocele you can see meninges plus spinal cord, meninges plus spinal cord. So so the meninges and spinal cord herniating out, meninges plus spinal cord uh, herniating out is called as myelin-meningocele, while the meninges is covering the spina bifida is called as cystica is called as meningocele, and myelin-meningocele is nothing but myelin sheath, myelin, meninges plus spinal cord are herniating. Okay, thank you.